Question 1. A 28-year-old woman is in labor at 39 weeks of gestation. The fetal heart rate is 120 beats per minute. The nurse notes that the woman is in early labor and has not yet progressed to active labor. What is the priority nursing action? A. Administer pain medication. B. Encourage the woman to walk around. C. Provide comfort measures and monitor the fetal heart rate. D. Prepare for cesarean delivery. Answer. C. Provide comfort measures and monitor the fetal heart rate. Question 2. A woman is 8 hours postpartum and is experiencing heavy bleeding. The nurse notes that the uterus is boggy and displaced to the right. What is the most appropriate action? A. Massaging the uterus and assisting the patient to empty her bladder. B. Administering oxytocin and assessing for signs of infection. C. Preparing for a blood transfusion and calling for a surgical consult. D. Administering antibiotics to prevent infection. Answer. A. Massaging the uterus and assisting the patient to empty her bladder. Question 3. A primipara is in active labor and is 8 centimeters dilated. The nurse notices that the fetal heart rate decelerates with contractions but recovers after each one. What is the priority action? A. Increase the rate of intravenous fluids. B. Prepare for an emergency cesarean section. C. Monitor the fetal heart rate and encourage position changes. D. Notify the healthcare provider and administer oxygen. Answer. C. Monitor the fetal heart rate and encourage position changes. Question 4. A postpartum woman is experiencing excessive lochia rubra. What should the nurse do first? A. Administer uterotonic medications. B. Perform a fundal massage. C. Prepare the woman for a blood transfusion. D. Assess for signs of infection. Answer. B. Perform a fundal massage. Question 5. A 32-week pregnant woman presents with complaints of severe headache, blurred vision, and edema. What should the nurse suspect? A. Normal pregnancy discomfort. B. Gestational hypertension. C. Preeclampsia. D. Hyperemesis gravidarum. Answer. C. Preeclampsia. Question 6. A nurse is caring for a woman in the immediate postpartum period who is experiencing severe abdominal pain. The uterus is firm and contracted. What is the most appropriate action? A. Administer narcotic pain medication. B. Assess for urinary retention and bladder distension. C. Notify the healthcare provider for possible uterine rupture. D. Reassure the patient that the pain is normal and expected. Answer. B. Assess for urinary retention and bladder distension. Question 7. The nurse is assigned to care for a woman in labor who is experiencing back labor. What position would most likely relieve the pain? A. Side lying with the legs in stirrups. B. Squatting with the support of a partner. C. Hands and knees position. D. Lying flat on her back with a pillow under her head. Answer. C. Hands and knees position. Question 8. A nurse is caring for a patient with a diagnosis of preterm labor. Which of the following interventions is most important in promoting fetal well-being? A. Encouraging the patient to rest in a left lateral position. B. Administering corticosteroids to enhance fetal lung maturity. C. Providing emotional support for the patient and family. D. Monitoring the cervix for signs of dilation. Answer. B. Administering corticosteroids to enhance fetal lung maturity. Question 9. A woman in labor is receiving an epidural for pain management. What is the priority nursing assessment after administration of the epidural? A. Assessing the woman's blood pressure for hypotension. B. Checking for signs of urinary retention. C. Monitoring the fetal heart rate continuously. D. Observing for signs of infection at the injection site. Answer. A. Assessing the woman's blood pressure for hypotension. Question 10. A 24-year-old woman in her second trimester is being treated for a urinary tract infection. What should the nurse educate the patient about regarding antibiotic therapy during pregnancy? A. You may need to stop taking the antibiotics if you experience nausea. B. You will need to increase your intake of fluids while taking the antibiotics. C. It is important to stop the antibiotics once you feel better. D. You should avoid any over-the-counter medications while on antibiotics. Answer. B. You will need to increase your intake of fluids while taking the antibiotics. Question 11. The nurse is caring for a pregnant woman with a history of a previous cesarean delivery. What is the primary consideration when planning this woman's delivery? A. Administering an epidural early in labor. B. Offering a trial of labor after cesarean, TOLAC, if appropriate. C. Avoiding vaginal birth due to a high risk of uterine rupture. D. Preparing for a cesarean delivery at 39 weeks. Answer. B. Offering a trial of labor after cesarean, TOLAC, if appropriate. Question 12. A nurse is caring for a 3-day postpartum woman who has a red, warm, and painful area in the breast. What should the nurse suspect? A. Breast engorgement. B. Mastitis. C. Postpartum depression. D. Galactorrhea. Answer. B. Mastitis. Question 13. A nurse is caring for a patient in the 3rd stage of labor. The nurse notes that the umbilical cord is visibly lengthening. What is the nurse's priority action? A. Gently pull on the umbilical cord to facilitate delivery of the placenta. B. Continue to monitor the patient for signs of hemorrhage. C. Prepare for a cesarean delivery. D. Administer oxytocin to prevent postpartum hemorrhage. Answer. B. Continue to monitor the patient for signs of hemorrhage. Question 14. A patient at 32 weeks of gestation is diagnosed with gestational diabetes. What is the priority nursing intervention? A. Administering insulin as prescribed and monitoring blood glucose levels. B. Encouraging the patient to consume high-protein meals to stabilize blood sugar. C. Monitoring the fetal heart rate for signs of distress. D. Educating the patient about dietary modifications and glucose monitoring. Answer. D. Educating the patient about dietary modifications and glucose monitoring. Question 15. A woman in labor at term is experiencing variable decelerations in the fetal heart rate. What is the priority action by the nurse? A. Reposition the woman to alleviate cord compression. B. Increase the rate of IV fluids to improve placental perfusion. C. Administer oxygen to the woman to improve fetal oxygenation. D. Prepare for an immediate cesarean delivery. Answer. A. Reposition the woman to alleviate cord compression. Question 16. A nurse is providing care to a 4-week postpartum woman who reports difficulty breastfeeding. What is the priority nursing intervention? A. Encourage the patient to supplement with formula. B. Teach proper latch and positioning techniques for breastfeeding. C. Suggest using a breast pump exclusively. D. Administer pain medications for sore nipples. Answer. B. Teach proper latch and positioning techniques for breastfeeding. Question 17. A nurse is caring for a woman at 40 weeks of gestation who is experiencing decreased fetal movement. What should the nurse do first? A. Perform a non-stress test, NST, to assess fetal well-being. B. Encourage the patient to eat and rest and try counting movements again. C. Prepare for an emergency cesarean delivery. D. Offer the patient fluids and suggest walking. Answer. A. Perform a non-stress test, NST, to assess fetal well-being. Question 18. A woman who is 12 weeks pregnant presents with nausea, vomiting, and weight loss. What is the most likely diagnosis? A. Hyperemesis gravidarum. B. Normal pregnancy symptoms. C. Gastroenteritis. D. Urinary tract infection. Answer. A. Hyperemesis gravidarum. Question 19. A nurse is caring for a patient who is 28 weeks pregnant and has been diagnosed with a placenta previa. What is the priority nursing intervention? A. Prepare the patient for immediate delivery. B. Assess for signs of preterm labor and monitor fetal heart rate. C. Encourage the patient to rest and avoid physical activity. D. Administer intravenous fluids to improve perfusion. Answer. B. Assess for signs of preterm labor and monitor fetal heart rate. Question 20. A postpartum woman is experiencing excessive vaginal bleeding and a boggy uterus. What should the nurse do next? A. Administer uterotonic medication and massage the uterus. B. Apply ice to the perineal area and call for help. C. Prepare for an immediate hysterectomy. D. Increase IV fluids and monitor for signs of shock. Answer. A. Administer uterotonic medication and massage the uterus. Question 21. A woman in labor is experiencing sudden, severe abdominal pain and vaginal bleeding. The nurse notes a firm abdomen. What is the most likely diagnosis? A. Placenta previa. B. Abruptio placenta. C. Uterine rupture. D. Ectopic pregnancy. Answer B. Abruptio placentae. Question 22. A 30-year-old woman at 24 weeks gestation presents with complaints of leg swelling, headaches, and visual disturbances. What condition should the nurse be concerned about? A. Normal pregnancy symptoms. B. Gestational hypertension. C. Preeclampsia. D. Deep vein thrombosis. Answer C. Preeclampsia. Question 23. A nurse is caring for a woman who has just delivered vaginally and is at risk for hemorrhage. What should the nurse do immediately after delivery? A. Assess the perineal area for lacerations. B. Administer oxytocin to promote uterine contraction. C. Observe for signs of infection. D. Administer pain relief medications. Answer B. Administer oxytocin to promote uterine contraction. Question 24. A nurse is assessing a woman in labor and notes that the cervix is 6 centimeters dilated, 80% effaced, and the fetal station is at -2. What is the interpretation of these findings? A. The woman is in the latent phase of labor. B. The woman is in the active phase of labor. C. The woman is in the second stage of labor. D. The woman is in the transition phase of labor. Answer B. The woman is in the active phase of labor. Question 25. A woman who is 40 weeks pregnant is experiencing contractions every 2 minutes, lasting 60 seconds. The cervix is dilated to 4 centimeters. What should the nurse anticipate? A. The woman is in the latent phase of labor. B. The woman is in the active phase of labor. C. The woman is in the second stage of labor. D. The woman is in false labor. Answer B. The woman is in the active phase of labor. Question 26. A nurse is caring for a woman in labor who has received an epidural. What is the most important nursing intervention immediately after the epidural is administered? A. Monitor for signs of fetal distress. B. Assess the woman's blood pressure frequently. C. Encourage the woman to push with contractions. D. Assess the woman for bladder distension. Answer B. Assess the woman's blood pressure frequently. Question 27. A nurse is providing education to a woman about the signs of preterm labor. Which of the following should the nurse include in the teaching? A. Increased vaginal discharge. B. Severe upper abdominal pain. C. Constant headaches. D. Increased appetite and energy. Answer A. Increased vaginal discharge. Question 28. A woman who is breastfeeding complains of sore nipples. What should the nurse assess first? A. The infant's latch and positioning during breastfeeding. B. The mother's breast for signs of infection. C. The mother's milk supply. D. The infant's weight gain. Answer A. The infant's latch and positioning during breastfeeding. Question 29. A postpartum woman with a history of diabetes is having difficulty regulating her blood sugar levels. What should the nurse do first? A. Administer insulin as prescribed. B. Encourage the patient to eat high-carbohydrate meals. C. Monitor the woman's blood glucose levels closely. D. Contact the healthcare provider for an insulin adjustment. Answer C. Monitor the woman's blood glucose levels closely. Question 30. A nurse is caring for a woman with suspected chorioamnionitis. What is the most common symptom of this infection? A. Severe abdominal pain. B. Fever and tachycardia. C. Vaginal bleeding. D. Rapid fetal movement. Answer B. Fever and tachycardia. Question 31. A woman in labor is asking for pain relief options. Which of the following is considered a non-pharmacological intervention? A. Epidural anesthesia. B. Intravenous narcotics. C. Hydrotherapy, water immersion. D. Nitrous oxide. Answer C. Hydrotherapy, water immersion. Question 32. A woman is 6 weeks postpartum and reports pain in her left leg with redness and swelling. What is the nurse's priority concern? A. Thrombophlebitis or deep vein thrombosis. B. Normal postpartum changes. C. Uterine infection. D. Laceration or hematoma. Answer A. Thrombophlebitis or deep vein thrombosis. Question 33. A nurse is caring for a woman with a cesarean delivery who is experiencing difficulty breathing. What should the nurse do first? A. Encourage the woman to cough and deep breathe. B. Assess the woman's oxygen saturation levels. Call for a respiratory therapist. D. Administer supplemental oxygen. Answer. B. Assess the woman's oxygen saturation levels. Question 34. A pregnant woman is 14 weeks gestation and has a history of a miscarriage in her previous pregnancy. What is the nurse's priority action during her prenatal visit? A. Provide emotional support and reassurance. B. Perform a non-invasive prenatal screening NIPS test. C. Assess fetal heart tones and reassure the patient. D. Educate the woman on signs of preterm labor. Answer. A. Provide emotional support and reassurance. Question 35. A nurse is caring for a woman who has been diagnosed with a urinary tract infection, UTI, during pregnancy. Which of the following is true regarding UTI treatment during pregnancy? UTIs can be treated with antibiotics that are safe during pregnancy. Bacterial urinary tract infections should not be treated with antibiotics during pregnancy. C. UTIs are not a concern during pregnancy. D. UTIs should only be treated with over-the-counter medications. Answer. A. UTIs can be treated with antibiotics that are safe during pregnancy. Question 36. A nurse is caring for a postpartum woman who is breastfeeding. Which of the following is true regarding breastfeeding in uterine involution? A. Breastfeeding stimulates the release of oxytocin, which helps the uterus contract. Breastfeeding inhibits uterine contractions and prolongs the involution process. C. Breastfeeding does not affect the uterus after delivery. D. Breastfeeding causes uterine rupture in some cases. Answer. A. Breastfeeding stimulates the release of oxytocin, which helps the uterus contract. Question 37. A woman with gestational hypertension is being monitored closely for complications. What is the most significant risk associated with gestational hypertension? A. Preterm labor. B. Placental abruption. C. Postpartum hemorrhage. D. Fetal hypoxia. Answer. B. Placental abruption. Question 38. A nurse is caring for a woman who is 12 weeks pregnant and has a history of ectopic pregnancy. What is the priority nursing intervention? A. Educate the patient on the signs of a possible miscarriage. Perform a physical exam to assess for abdominal tenderness. C. Schedule an ultrasound to confirm the pregnancy location. D. Advise the patient to rest and monitor for symptoms. Answer. C. Schedule an ultrasound to confirm the pregnancy location. Question 39. A nurse is caring for a woman in early labor who is requesting pain relief. What is the most appropriate initial intervention? A. Administer an epidural anesthetic. B. Offer non-pharmacological pain relief techniques. C. Prepare for a cesarean delivery. D. Offer an intravenous narcotic. Answer. B. Offer non-pharmacological pain relief techniques. Question 40. A nurse is assessing a newborn who is 1 hour old. The newborn is exhibiting poor muscle tone and has a weak cry. What is the nurse's priority action? A. Place the newborn in a warmer and reassess. B. Administer resuscitation measures if indicated. Call for a pediatric consult immediately. D. Reassure the parents that this is a normal finding. Answer. B. Administer resuscitation measures if indicated.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.